All right. Welcome back. Let's continue now on the Health from Life session, second part. Nowadays, everybody, and we heard Professor Weinberg talks a little bit about it, everybody has heard about generative AI. And while some results could impress, for sure, very few efforts are truly open science and with the explicit ambition to elevate to a deeper knowledge and know-how in the field. In this next session, we're going to focus on how biotechnology, bioengineering, and AI, working truly together, are changing the game in biology and drug discovery. Our next guest, Dr. Lucas Nivon, is the CEO and co-founder of Cyrus Biotechnology, a company accelerating discovery of biologics and small molecule therapeutics via internal, but always as partnered programs. At the heart, there's an open framework called OpenFold, indeed providing new avenues for open science in the age of experiences. And at Dassault Systèmes, we consider open science to be very, very important. Let's welcome Dr. Lucas Nivon.
I'll open up a bottle of water here. Hello, everybody. I'm Lucas Nivon, CEO and co-founder at Cyrus Bio. I'm also one of the co-founders of the OpenFold, Open Source Bio AI Consortium, which I'll be talking about a little bit today. First, I'd like to thank Reza here in the audience for kindly inviting me and for fostering a spirit of collaboration between OpenFold and Cyrus and Dassault over about the last year or so. I'd like to make a quick remark that I actually hadn't thought of before Dr. Charles's talk. For those of us growing up as young scientists in the 80s and 90s, we saw CAD as sort of done, right? CAD had come, and you had had this age of, we used to build a wooden mock-up of a plane, and then CAD came, and then now it's fully designed in a computer to the point that it's insane to think that you would make an airplane, right, and design it without it being fully in silico, and then you go and make a plane, right? But the notion that you do that in drug discovery, either biologics or small molecule, would have seemed maybe naive at best in the 90s. There were attempts at it, but it was early days. And literally, when we started Cyrus as a pure software company, we pivoted to drug discovery. We would pitch and say, look, when they used to make airplanes, they would build a model out of wood, and then CAD replaced that. And that is going to happen in bio. That's going to happen in drug discovery, right? It's taking time, but that time is really here now, for biologics at least. So that's what I'm talking about. So I'm here to tell you about foundation models, foundation AI models in protein AI, and how we can create value using AI in biotechnology. If you remember one thing about this talk, it's that AI models can be wrong. They can be right. And Bob Weinberg was here. He's maybe more of an AI pessimist. I'm here to be an optimist and a pessimist, and I think an AI realist. We have to understand, when is the AI making things up? Now, again, I'm the CEO and co-founder of Cyrus Bio, just to remind you. When ChatGPT, right, a large language model, when ChatGPT came out, we asked it, I didn't do this, some of the employees, who's the CEO of Cyrus Biotechnology? The current CEO of Cyrus Biotechnology is John M. Atwater, who is not a real person. Could you check again? Yes, a quick search confirms that he's the CEO. What about Lucas Nivon? No, Lucas Nivon, unfortunately, I've been demoted by the AI to COO. We can all tell that the AI is wrong. If you have knowledge, we can tell that the AI is wrong because it's intelligible text, right? And the key point here is, for bio, the output, even those of us who are expert, we can't know if it's right or wrong until we do experiments, right? So that's the core message I want to get across. So what's happening now in the AI world for bio is that for many problems, the classic tools are still superior to these new AI methods. On the other hand, for many problems, the AI methods are better. So the new tools, AlphaFold 2 from Google is probably the one that most of you have heard about. We created the OpenFold consortium, ESMFold out of Meta, These are really revolutionizing many applications where they're just superior to traditional methods. The traditional methods, for us, that's Rosetta Hybridize, that's molecular dynamics. Martin Karplus is here, Nobel Prize winner, to represent that world. That's physical simulation. These tools are adaptable, they're still expensive, they have failure modes, but they have modes where they're better. And that's the world. We're in this half AI, half physics world. One of the examples of this is ESMFold out of Meta. Meta is Facebook, of course, against our OpenFold created by Mohammed Al-Quraishi at Columbia University. You can see these trade-offs. So ESMFold is a protein language model, a PLM. It's much faster. It's a little bit less accurate. It's a great first pass. For many problems, it's going to be just as accurate, but the model can actually tell you when it's wrong, which is nice. So we can do a first pass. It'll say, I'm right or I'm wrong. If it's wrong, we go to deeper modeling, and that can often include physical modeling. By the way, at OpenFold, which Dassault you'll see is a sponsor of, we're about to release SoloSeq, which is a fully open source protein language model, structure model, dual model that's trainable. We'll talk about why trainability is important. Again, AlphaFold is terrific. I'm here to tell you the pessimist side. AlphaFold cannot tell good mutations from bad mutations. This is well known. This is an open secret. People don't brag about it. It's not that fun, but it cannot tell. One of the best ways to show this is in the lab. We can find mutations that kill a protein, lethal, that make the protein unstable. Each one of those on its own breaks the protein in the lab. We took 50 of those, right, in a protein that's about, so 25% of the protein, put that into AlphaFold, and it comes back and says, yes, this folds perfectly. I am very confident that it folds correctly. But that is 100% wrong, right? And you only know that because of the lab. So AlphaFold is not good at mutations. We know that. Google, DeepMind, they also are everybody's aware of that. There's other limitations. The AI tools are limited in biochemical scope compared to Rosetta and physical modeling. Rosetta, by the way, I should have said that, is the statistical physical model that forms a lot of the work that Cyrus is based on out of David Baker's lab at the University of Washington. The AI tools are limited in what types of amino acids they can cover. They're limited, and this, I think, is the biggest limitation in modeling ligand-binding proteins, how a protein binds to a small molecule. That's relevant for all of small molecule discovery. So that is not a small point, right? And that's where OpenFold is going next. Nucleic acid modeling, here's a Cas9 CRISPR. Feng Zhang, right across the river here at MIT. Nucleic acid modeling is lacking in the AI tools. Tools like Rosetta, like molecular dynamics, can cover really all of biochemistry right now. There's also AI protein design tools, mostly out of David Baker's lab, out of other companies, other groups, protein MPNN, RF diffusion, to name a few of those names. We've done a lot of work on these. Looking at how they compare to experimental data, we found that AI protein design tools are best suited for fully de novo proteins. That's a protein where you let the computer create the whole thing, or most of it, but not for partial protein redesign. So at Cyrus, we've tested in the lab situations where we have 100% de novo, the computer can make the whole thing up, 80% down to 50%, all with protein MPNN out of David Baker's lab. We're finding when we go too low, if you don't let the computer have enough control, those do not work in the lab. Those proteins don't work in the lab. When you let it go higher, that the computer can change most, 80, 100% of the protein, those work broadly across multiple use cases, not just in terms of the protein is stable, that we can manufacture it, but also that it has the desired physiology in a cell. That's where we are right now. Now, take a step back. A lot of what we do, what people use Dassault software, what we do at Cyrus for proteins is taking a natural protein, making a small number of mutations to turn it into a great drug. So we want to know, can the software predict the effect of a mutation? Is it going to be good or bad? It turns out that MPNN predicts experimental point mutations very poorly. You can see this is basically noise. This is a scatter plot between experimental data on the y-axis and on the x-axis, the computational score. It compares very poorly compared to the latest physical statistical models, and you can see just obviously that should be a line and Dr. Charles talked about we're lacking some of the understanding in biology, and this is lacking understanding. Right? It has a weak correlation. Actually, don't have that on the slide. At Cyrus, we have our own proprietary tool to predict mutations that correlates much better. The outputs are also far less interpretable. Interpretability is an issue we hear over and over again for AI. So we're really limited now in terms of mutation prediction. So this brings us to OpenFold. When AlphaFold 2 came out of Google, we were all very impressed. And it was a good step forward, applying the latest transformer models, as they're called in AI, to protein modeling. So we decided to co-found OpenFold, which is making shared AI models for biopharma. That was co-founded with Genentech, Prescient Design. Oh, I was going to redesign this slide to rebalance it a little bit. Genentech, Prescient Design, Outpace, our Zeta. So this was a group of people who had all come out of David Baker's lab. We're really happy now in the fall to have Dassault as a sponsor, and Dassault now starting to integrate OpenFold into tools going forward. And I think you'll hear more about that over the future. Many companies already have. Other major pharma companies joining, and we're about to make some announcements. I'm not going to let it slip out. We're about to make some announcements about other big tech companies and pharmas who are supporting. OpenFold is a fully open source protein foundation model for structure prediction, for going from sequence to structure. The key point there is when Google released their models, they were not fully open source for everybody to use. They were not useful for commercial entities, which were the ones that discover the drugs, that bring them to market. So we needed a way to do that in biopharma. That's why we made OpenFold with Mohammed Al-Quraishi at Columbia University as the lead PI for the beginning of OpenFold. Now, of course, you've seen this in the news. The AI folding protein algorithms like OpenFold are extremely powerful. They make more proteins approachable as computer-designed biologics or for biology discovery. Now, this is not common knowledge. There's about 200,000 structures in the protein data bank of actual structures, so solved experimentally in the laboratory. AlphaFold 2 had a first release of structures that was about 1 million at high quality. And then their next release was about 200 million structures. So you're talking about more than a 100-fold increase in the number of structures modeled. Some of them are less accurate than others, caveat again. But clearly just a massive advance, and everybody's using AlphaFold now. They'll start to use OpenFold over time. Now, OpenFold enables anyone to modify and make new models. That's the key. It's modifiable because it's fully open source. AlphaFold, of course, is highly accurate. It's in Jack's platform. They did not release the data. OpenFold's highly accurate. It's in PyTorch, which is much more extensible and widely used in research. We have released all of the underlying data, the MSAs. And really the key point, AlphaFold did not release training code. OpenFold did release training code. You may be asking, well, who cares, right? Do I care about trainability? So the best AI models require retraining on data, and OpenFold enables that, right? You could not do this with AlphaFold. There's a number of examples from other areas of AI. Here's one example showing a drastic improvement via retraining on what's called AlphaFold multimer. So here's a structure of two proteins binding to each other. Most applications for biologics discovery, you have to model not just one protein on its own, but how the two interact. So a number of groups tried to make versions of AlphaFold when it came out to do that, to do this. That's called a multimer or a dimer, right? How two proteins interact. And you can see here, I'm measuring how accurate, so higher is better in terms of accuracy. Those groups without retraining, those are the groups here on the right-hand side, they got accuracy. But then Google came back with AlphaFold 2 multimer that was fully retrained, which only Google could do at that time. Now we can do it too. Sorry. Only they could do that because they had the training code, right? None of us had it at that point. And then they blew everybody out of the water, right? They're 40% better than everybody else at this type of structure prediction for AlphaFold 2 multimer. Now we have that in OpenFold. It's about to be released, not quite done yet. But the key point is you can do this in many domains, right? You can train on your own data. This is what OpenFold is all about. It's what open science is about. I'd like to give a few examples from Cyrus and from Dassault of how we can use traditional modeling, physical, statistical modeling, and AI and ML to really discover new biologics. The first example is a next-generation Fabrazyme for Fabry disease. Fabry is a rare inherited disease. It leads to kidney and heart failure. Life expectancy is into your late 40s. It's not a childhood fatality disease. We're grateful there is an existing enzyme replacement therapy, Fabrazyme. It's a $1.5 billion market, Fabrazyme and Replagal. But these people are missing an enzyme, and then you're injecting the enzyme into them. And the immune system says, oh, this is a foreign molecule, right? It's like an infection. I'm going to fight it, right? I'm going to have an immune response against it. That's called anti-drug antibodies. It's very common. This is one of the most immunogenic biologics. In 70% of patients, this is limiting efficacy or blocking efficacy, right? So this is a great drug, but, right, in most people, it's actually not working anywhere near its potential. Bob Desnick at Mount Sinai has the Department of Genetics. He invented Fabrazyme over 40 years ago. We started work on this at Cyrus to redesign, using these AI tools, a less immunogenic, safer version of Fabrazyme, right? We're going to get that 70% down. Is it going to be 5%, 1%, 20%? We know it's going to be better. We haven't gotten to the clinic yet. Bob Desnick was so excited. He said, we've been waiting 30 years. We've known about this 30 years. We've been waiting 30 years for somebody to come and make this better version. We couldn't do it, right? Because we didn't have these AI tools, and now we can. So we already have a lot of preclinical data showing the superiority of this molecule. We're starting IND-enabling studies by the end of the year. This is currently in mice, in mouse models of Fabry. We're very excited to bring this to patients, bring it to the market, thanks to AI. This shows the rough path. I won't go in detail, but the point is we're going through multiple steps. And going back, I think, to what Bob Weinberg was saying, to what Dr. Charles was saying, we're iterating with data, with experience, right, with experiments. You guys had this question, experience, experiments, experience, it's the same thing. And we're going step by step, right? And we're touching immunogenicity and solubility. This gets technical, right? Solubility, stability. We're optimizing across parameters, using data, using the models, improving the models as we go to get to superior preclinical candidates. And this is currently in Bob Desnick's lab. Second example I'll give from Cyrus. This is an announced collaboration, $1.5 billion total milestones with Selecta Bio on a 3-target deal. Here we're modifying IL-2. IL-2, for those of you who don't know, it's a signaling protein called a cytokine that's involved in immune regulation. Some companies are pursuing it for oncology. Some companies are pursuing it for autoimmune. This is an autoimmune application of IL-2. Some of you may have seen IL-2 as a popular target. Pandion with Merck, BMS with GentiBio, Nektar had some popular target for autoimmune. And Selecta had this idea of how their nanoparticle could combine with a new IL-2 molecule to create a superior therapeutic. And I'm not going to go into the detail, but this is the preclinical data supporting that, where you take their nanoparticle in green, you combine it with an IL-2, a mutated IL-2, and then in red, you get much better autoimmune response. And that's a massive increase. You don't see responses like this in bio. We're all very excited about this, and then now Selecta has announced this program's called ImmTOR-IL, and they announced a few months ago the first indication in primary biliary cholangitis, PBC. That's an autoimmune disease that causes liver failure. And we have our fingers crossed. We hope this will move across the finish line again. This one is literally, and I can't disclose any of the actual details, literally half physical statistical modeling and half AI. And actually, it may be that the AI wins. We're trying both. I'd like to think about how this can come into the work at Dassault and Dassault's partners in terms of bringing AI to the market to really influence a broader swath of discovery efforts. Here's an example in how you might think about CAR T cell therapies now. Dr. Weinberg talked about CAR T therapies. Of course, they rely on molecular recognition on the left-hand side. Could be used for personalized medicine. And of course, a lot of manufacturing downstream, incredible complexity of manufacturing. All of these can be touched by Dassault products as they currently exist. And now as you're doing this type of discovery now, you're going to the lab and you're enabling in green with AI, in my view, I think in Dassault's view, in the future, right? So you're in the lab, you're identifying antibody hits. You're in the lab and characterizing antibodies. Now we're thinking about, with AI, that type of data at customers, inside companies like Cyrus. That's training data now. It's making a molecule, but it's also training data for better antibody software. You're determining structures. That's in the lab. Right now, OpenFold is not great at that. I'm not going to say that it's better necessarily. It's a little better. But what if we make better versions of OpenFold in the future that incorporate this data, and OpenFold antibody can actually obviate the need to solve some of these structures? And then the next step, you're building models in the future. That's already OpenFold Multimer. OpenFold stability is something we're currently working on. You're making mutations to improve those antibodies. There's already antibody large language models. Large language models are what ChatGPT is. Protein MPNN is a design tool I mentioned. Maybe in the future there'll be, not maybe, there are definitely going to be new antibody design AIs that are language models and structure models. And then, of course, as you go to the clinic, you're thinking about manufacturability, about safety, tolerability. We're going to have AI models for those also. At Cyrus, we work on AI models for non-antibody biologics. You're going to have those models, and some companies already do, for antibodies. In the last few minutes here, I'd like to think about where the field is headed. Are we really going to make a big clinical impact? Is that already happening? I'd argue it's starting to happen, but how big is it going to get? And I think it's useful for those of us in the field to think about other tech fields that have taken some time to mature, right? This is really a question. This isn't a guarantee, and there is a lot of AI hype right now, right? And from that hype, you'd think, well, we're going to cure cancer, we're going to cure everything instantly, but that's not necessarily the case. So I like to think about electric vehicles. We're 130 years in now to the electric vehicle experience. That's the first one, as far as I could tell, in the 1890s. And of course, we were not all driving electric cars for the last 100 years. This technology is beautiful, but it's taken 130 years to really make a market impact. Is that what's going to happen with bio AI, with protein AI? Right? Are we in the 1890s or in the 2020s? I mean, my view is that we're there. But we have to make it happen. Why is it going to happen? It's going to happen because it's the intersection of what protein AI can accomplish in blue, and then the actual clinical need, the pull from the clinic. It has to be not just, can we do it? We can do a lot. If you talk to David Baker now, and David is brilliant, David will say, oh, we can do anything. And he kind of can, right? But it has to fit clinical needs. Should we do it? And it's that intersection of figuring out where does there match, and then moving the blue circle over to the right, right? That we're adding the capabilities of protein AI over time. So that's where we're going, right? So many problems are still better solved by physical modeling, by molecular dynamics, by free energy modeling, by statistical physics in Rosetta. But new AI tools, in our view, are going to surpass those tools. And Bob Weinberg was saying that he's an AI skeptic, and I was an AI skeptic for years until AlphaFold came along. We were trying. We were doing AI in-house. And the models never beat our old models, our physical models. So we've seen this happen. It's going to happen in protein stability by adding data. We're hoping to be supporting that. We're having early talks for that as part of OpenFold. Huge data sets, millions of data points. It's going to happen in small molecule drug discovery. That's OpenFold ligand. It's called OpenBind out of Mohammed Al-Quraishi's lab. That's going to be a major step forward, in my view, and in Mohammed's view, in small molecule discovery. Fully trained antibody models. That hasn't yet been released for OpenFold. That hasn't yet been released for AlphaFold. Those are obviously going to happen. That's going to be a priority for the field in the future. I mentioned manufacturability, safety for antibodies and for proteins. At Cyrus, we're focused on non-antibody, but for antibodies also. And then new modalities going forward. Cell therapy is going to be hugely important, especially in oncology, gene editing, new applications that, standing here right now, I don't even know. So in my view, we're at the beginning of a $300 billion industry transformation of the biologics industry specifically due to AI. Biologics are 30% of current therapeutics by revenue, but they're half of the R&D spend in the pharma industry. And we're just at the beginning of that transformation. Last year, the first drug was approved out of David Baker's lab with SK Bio as a vaccine, a temperature-stable vaccine for coronavirus. Came after the beautiful work from Moderna, which you just heard about, which got to market first, of course. That's the first one approved out of David's lab, but that's just the beginning. In 10 years, most biologics are going to be partly or completely designed by algorithmic methods. And we're just at the beginning of that transformation, thanks to this combo of statistical physics and AI. Thank you.
Thank you so much, Lucas. Very inspiring. Maybe because of time, no questions, but a comment just for you or an interaction. You mentioned experimentation and AI, ModSim. I have the impression listening to you, and I want to have your feedback on that. Since you're able to retrain, which is fundamental to any kind of scientific endeavor, formulate hypothesis, confront reality, then move forward, I have the impression that experience applies in both worlds, in the data real world and in the model virtual world, experimenting and theory, but experience overall. Mm-hmm. And in fact, ModSim goes hand in hand with AI instead of opposing them. What do you think?
Yeah, 100%. I mean, we're constantly iterating on the models. AlphaFold was a major model innovation. The data had been sitting there for years. But yeah, experience.
So
we do so many iterations.
So waiting for OpenFold. Thank you very much, Lucas.
Thank you.
Thank you.
Thanks for having me.